back after that well important discussion. I think it was rather more of a learning time as we heard from the justice and of course Reginald Addy, who was being schooled. Yes, for me, of course, I've had such celebrations with the justice on countless occasions, but Reginald was being schooled. So yes, welcome back after that. We've kicked the men off and we ladies are here to do justice to something that is, yes, it borders on social and it also borders on health, the health of our children. You know that when things affect us as parents or as adults, we tend to, especially when it's women, I know women are able to bear pain, to bear with a lot, you know. Yes, just say, oh, it's all fine, it's all good. Just because we are the ones bearing it, we know how to, perhaps I need a little rest, or I need this. I don't want to extend the pain onto others. But it is very, very, very hard for us to watch children go through certain things, go through, especially when it is bordering on their health concerns. And it is definitely of utmost importance that we describe or we try and define and discuss this particular issue. We have childhood cancers, especially as it's been on the rise, and we hear it all the time of late with children. We thought cancer was something that happened to people when they are growing. Well, that has already been ravished because now we see even children as young as 2 years suffering from one type of cancer or the other. In fact, coming from an article I chanced upon, coming from World Health Organization, it says that in Ghana, about 1,200 children under the age of 15. Can you imagine that? 1,200 children under the age of 15 are estimated to develop cancer annually. Yes, in just a year. So, like 2021 just passed by. The estimate for childhood cancer alone for children under 15 is 1,200. That is a cause for concern. In addition to some of the cancers that they are said to have is leukemia, lymphoma, retinoblastoma. If make bad, don't worry, I'll be caught because I have someone here who is more knowledgeable, yes, very experienced when it comes to childhood cancer. So let me finish with this: retinoblastoma, Wilms tumor, soft tissue sarcoma, neuroblastoma, which are the common or the most common forms in the country as at the moment. I have none other with me than from the pediatric oncology department. Hey, and then my couple of power. Pediatric oncology department, Dr. Nana Akosua Afare. Doctor, good morning and welcome to AM Ghana.
Good morning, Julia. I really enjoyed your intro. Yes. And you didn't make a mistake, so it's all correct.
Oh, yes. I deserve a star for that. Unfortunately, I have to shed this star because what we are discussing is something that is rather sad. It rather casts a shadow because what we all want to see, and I have been a teacher before. Well, they say once a teacher, always a teacher. And one of the joys, well, what always wants me to go back to school, to the teaching field, is to see children playing. I love to see children playing, gathered, and they're having fun, and they're throwing their arms in the air, laughing at, you know, it's a joy to watch children play. And so it is sad to see maybe one child not being able to play because they are suffering from one thing or the other. Please tell us about childhood cancer, because I know that whichever way it puts the child out of the playing ground, whichever way child goes through pain. Tell us what the whole childhood cancer is the same as the cancer we know for adults, where there is something that is not doing functioning well or growing out of proportion and all that. Help us with that.
Okay, so like you said, we have childhood cancer and we have adult cancers.
All right.
So the childhood cancers are categorized as the ones that occur from birth to 18 years. So there are some babies that are already born with the cancer ongoing. So you can give birth to a newborn baby, a fresh baby, and the baby already has the cancer in his kidney. So from birth to 18 years of age, if you have a cancer, it's called a childhood cancer.
Okay.
And like you mentioned, we have the retinoblastomas. That's the cancer of the eye. So those ones usually manifest. Yes, they usually manifest in the eye first, and if you don't cure it early, it will spread to other parts of the body, and then cause the death of the child. And then we have the cancer of the kidney. That's the nephroblastoma or Wilms tumor. That's one of the cancers with the best cure rates. That's the kidney tumor. It's very good. We are able to treat it if it's found out early. So basically, the issues with childhood cancer is people don't seek for medical attention early. That's the #1 issue in our part of the world. When you look at outside the world, like the westernized countries, usually they have a very high cure rate because their patients come early. So the parents are very attentive and they are very observant. So they observe that the child is complaining of a lot of pains and aches. And they wouldn't just brush it off like the normal average Ghanaian parents who say, and now the person fell down. So let's massage him. I mean, some people come and they have such a huge swelling in an obvious part of the body, maybe the jaw or the neck or the leg, and they've been home for like a year. So it makes you wonder. So they come to us at Kolebu and things don't go well and they pass on. And it's almost as if when we came, we couldn't do anything. But if you come early, it helps us to cure the people. And yeah,
so we are saying that just with all cancers, just like childhood cancer, it needs to be detected early.
Yes.
Early detection equals a higher rate of survival as well. So you were saying that some are born, I mean, yes, gone. Obviously, when you think of childhood cancer, it quickly, brushes off or categorizes that as a myth, where we thought that adults were the ones, maybe your cells are all worn out, they are tired, and that because they are tired, they give way or they give in to these form of diseases and all that. But when you say that most of these childhood cancers start at birth, which means while they are being conceived, with every part developing, the cancer is also developing. That means that there is a cause for that as well. So can you help us with what causes that? What causes a child to develop with cancer?
Okay, so this is the point where I have to break the bad news. It's hard for us to accept it as it is now, but we've still not found the cause. Not just in Ghana or Africa, but globally. Research is still being, there are some things that we are finding, like exposure to radioactive material or nuclear material, like bombs, and exposure to certain hard metals and certain toxic chemicals. Those predispose your child to getting cancer, like the woman, if you are pregnant.
So let's bring this down to home, because sometimes when we talk about these things, some of us feel in Ghana, I mean, you're talking about metals and things. I work in a market. I'm pregnant, I'm working in the market and all that. I go home, I live in a community that has perhaps, it's essential. There are no industries and all these things around. So then it means I'm safe. But I know that sometimes when we talk about these metals and things, we even encounter them in their basic form. Maybe even the water we drink, maybe the food we. So help us with that. How?
Okay, so let me calm down. So when I mention these radioactive and metal, I mean certain specific metals. So not generally the ones that we encounter in our food and water. There are some toxic materials that, as laboratory scientists and doctors, we come into contact with. And those ones can predispose you to having a child having certain mutations. So the average Ghanaian is not exposed to those
ones.
Yes. The average normal, unless your job is something that you go to the lab every day and you're dealing with certain chemicals, and they know that. So even before they go to the lab, they take the necessary precautions to prevent those things from occurring. But then those in those countries like Russia and those war zones and the rest.
Okay.
That aside, we are still trying to find out the exact cause. But like you said, it happens when the child is being formed.
All right.
So it's in utero. It happens when the child is in the womb.
In the womb.
Exactly.
Okay. So what are the other causes in terms of the other types of? Is it all these types that develop in the womb?
No.
So for the others as well, what are the
so the ones that occur in the womb, those are usually the kidney tumors and then the tumors of the internal organs. But from 3 months upwards, then we have some manifesting in the eye, some is of the blood. So like the leukemia you mentioned earlier, it can start in infancy. You can have a baby as young as 6 months coming with leukemia, or a child as old as 11 years coming with leukemia.
So, our time is up, but please help me. How as a parent can I identify, because we talked about the white people and how they are able to easily, because they take care of their children, they are attentive to certain details. We here, I'm in a rush every morning to come to work. I have to also take care of the children, make sure they are well bathed, prepared, ready, and perhaps I even have to drop them at school before coming. What are some of the symptoms? What should I look out for to make sure that my children are not, they aren't in any way affected, they don't have cancer? What are some of the maybe easily noticeable things I can just see and say that, okay, I think I've identified A and B, I need to take my child to the hospital?
So I'm going to answer that question.
Okay.
But before then, I just want to make this comment that most of the parents actually notice it early.
Okay.
They notice that something is going on with their child. But then they would rather go to a herbal or a prayer camp or start some herbal treatments for some time before they end up coming to the hospital when they realize that things are not going well.
Okay.
So basically the symptoms, like you asked, includes with the eye cancer, you'd see that the eye is getting swollen over time.
Okay.
And then sometimes you see there's a white spot in the eye of the child. Sometimes you don't see it redly. But when the child takes a picture, you see that there's a red, we used to call it, we used to make fun of it, we thought it was normal when we were kids.
Okay.
But when you take a picture for your child and you see that red spot, you should draw your attention.
Okay.
And then weight loss, if you realize the child is losing weight without any provocation, children don't usually lose weight that drastically.
Okay.
Also, we have lumps and bumps. If you notice the child is having any swellings on parts of his body, his neck is just growing big, and most of these lumps, they grow very fast. So you notice that within a week they are going, it's like progressively increasing. You have to come to the hospital. You don't wait for like 3 weeks before, a month before you come.
Okay. All right. So unfortunately, this is how far our time will have us. But I believe that even taking nothing at all from this discussion, we're telling you that whatever you detect is wrong, whether it is related to cancer or not. Don't self-medicate. Don't try things. It's not the time for experimentation. It's the time to send your children to the hospital. Go and get some exam, right, done. Let us know. Do it.